The Central California Regional Obesity Prevention Program is a program of the Public Health Institute. This valuable work is made possible through support from the California Endowment and the Robert Wood Johnson Foundation.
The Central Valley has some of the highest rates of soda consumption in California, especially among youth. This problem persists in the valley where poverty rates are high, many residents do not have access to potable water, and sugary drinks are often the cheapest beverage available. So what do we do about it? CROP is educating community members and youth advocates about the dangers of sugary drinks and the potential benefits of local policies that decrease sugar-sweetened beverage consumption. In San Joaquin County, our partners are beginning to make a difference.
77% of our youth consume at least one or more sugar-sweetened beverages per day, and that's the highest in California. It's related to obesity in our county, so our youth and adults also have high rates of obesity and overweight. And so we know that there's a direct correlation between sugar-sweetened beverage and obesity, and if we can address at least one of the issues, then we can begin to address the obesity issue.
Shanae Bowie works for San Joaquin County Public Health Services and is a CROP lead. She facilitates meetings of the Obesity and Chronic Disease Prevention Task Force, which works to counter sugary drink promotion and other obesity prevention topics. The task force includes more than 40 different agencies and individuals, including the Community Partnership for Families of San Joaquin. This group works directly with youth through the Family Resource Center in Stockton. As part of their campaign, they have prominently displayed facts about how much sugar is in some of the most popular drinks.
This community being the demographics of people who are very low income, high chronic disease rates, we wanted to make sure that people who come in here have knowledge of this information. People do come in and take a look at it, especially children. They're looking, normally they find their favorite drink and then they're like, that much sugar. People are very surprised to find out the amount of sugar that they're actually drinking.
A great example is that one of the highly sweetened drinks is Capri Sun, practically a lunchbox staple.
So parents are very surprised when they are looking at this to find out that there's that much sugar that their child is drinking. And if they're having one at lunch and maybe one at dinner or before they go to bed, that's 18 teaspoons of sugar, not to mention all the other stuff they've eaten in that day. And our county is very high for chronic diseases such as obesity, diabetes, heart disease, and things like that, which all get started at a very early age when children are starting to, learn to develop their taste buds for these type of drinks.
Some habits are hard to break. 17-year-old Alberto is a member of the Youth Task Force, working to educate his peers and his family about the danger of sugar-sweetened beverages. He knows it's a tough sell. His dad has diabetes.
Trying to keep him out of soda. He drinks a lot of soda.
Alberto is also sharing the dangers of offering soda to very young children.
That in my family, there's have two babies right now, and I'm seeing that they're giving them soda a lot, and always telling them, don't give them soda because they get addicted. So just give them water, milk, healthy.
Task Force members know that healthy options can be tough choices for people to make, especially if environments don't support the change.
We knew that it was going to be a challenge because, of course, everybody likes to drink soda. It tastes good. Everybody likes to consume unhealthy food or junk. It tastes good. But then what we try to do is say, okay, what do you think is the implications for consuming this, or what do you think the implications are for marketing like this? And so when it comes from the community, the residents, they actually own it. We just kind of facilitate the process. So it makes the challenge less challenging. So we always get the question or just are engaged in conversations with residents in terms of, well, it's cheaper for me to buy soda or it's cheaper for me to buy junk food. And our conversation is always, in the long run, it ends up being less expensive to eat healthier because your quality of life ends up being better than if you basically go the cheaper route now, then you have challenges later in life. And so we always get kind of that conversation, but we try to just base it more on quality of life and investing in the health of you and of your children.
CROP understands the critical link between sugary drinks and obesity and has gone beyond educating community members to creating healthy beverage environments. Here are some ways that CROP has helped to transform beverage environments. In Stockton, local youth worked with elected officials to develop a city proclamation for Childhood Obesity Awareness Month, which urges the importance of public awareness in preventing childhood obesity. In Atwater, a local baseball league has adopted a soda-free season. In Earlimart and Fresno, schools are improving access to fresh, free drinking water by establishing water stations and maintaining existing water fountains. Here are some things you can do to ensure that community members have access to healthy beverages. Eliminate advertising of unhealthy foods and beverages to children and youth. Eliminate the sale of sugary drinks, including sports drinks, on city, county, and school district properties. Establish taxes on sugary drinks at a local level to fund treatment and prevention of obesity. Enact city and school vending policies that promote healthier beverage choices. The Central California Regional Obesity Prevention Program helps to create healthier communities in California's San Joaquin Valley that support healthy eating and active living. CROP is among a growing number of programs in the nation who use a policy and environmental change approach to help community members gain access to healthy food, beverages, and safe places to be physically active. The Central California Regional Obesity Prevention Program is a program of the Public Health Institute. This valuable work is made possible through support from the California Endowment and the Robert Wood Johnson Foundation.